Hi, everyone. So yes, I am Kim Searles with Beneficent. Everybody say Beneficent. So some of you have heard the movie Maleficent. That's the evil side. Okay. So beneficent, it's an old word. It means doing good for others. So we're bringing it back. Okay. I am the director of education. I also have with me Stacy Osborne. She is the owner of Beneficent. She's also a CMP, a certified Medicaid planner. We're going to talk about that later and what that means and how that helps you. Okay. So, but today we're going to talk about how to pay for long-term care without going broke, without running out of money. All right. So, but before we get started, I want to just kind of hear from a couple of you. There's some of you I've already spoken with, just trying to understand are you taking care of a loved one? Is it a relative? Is it a spouse? Is it a neighbor? So if anybody wants to share, we'd love to hear from you. Yes. Okay, we're going to talk about that. How could we get that taken care of so you can get some support? That's good. Yes. Mhm.
She's already spent down.
Yeah, they spent down everything.
Oh, so she's on Medicaid. Fantastic.
Yeah, well, no.
Yes. Yes.
A nightmare.
I have to move her by the end of the month down here. I found a place, Crestview. He wants her. He already reserved the room and everything.
Yeah.
But
And you did say they're at your own pace.
Yeah,
Innovate.
he doesn't accept pays. So,
We'll get
Yeah.
that specific case.
So-
Coming
Yeah.
very, I mean,
Yeah,
soon.
coming fast.
I have to do this. I mean, it's not, and then Thanksgiving's coming.
Yep.
Christmas is coming.
All the holidays, they just keep coming, don't they? Yes, but we will talk about that. How can we help support you as well? How about one more? Go ahead. Yes. Okay. That's a lot. Okay. What's the next step? Yes. Okay.
so when you're talking, if you can push the little button that looks like a person with something coming out of their mouth, your red light will go on and then we'll all be able to hear. So it's hard to remember, but you know,
Testing, testing. Come in, please.
Yes.
thank you.
All right. So we've got lots of information today we're going to share with you. So I'm just going to jump in. You can see me okay? I was worried about you, Mark. Okay, good. All right. So if you, I think there's one more seat there. If you can't see me or whatever. Okay. So we're going to talk today. A few things is that we're going to learn how to protect assets and make the most of what you have. Right. And then we'll go over some of the facts. There's a lot of myths out there and we'll help share some of the truth around that. And then understanding how to balance one spouse in care, right? And the other one that's at home. How can you get support with that as well? And then discover the truth. If you want to get the state to pay for long-term care, can you really give assets away? The answer to that is yes, but we're going to talk about that, okay? All right. At the end of this, you will be able to give me your feedback. I think it's important that you share your thoughts on the class. If there's anything that you think that we should modify, please, or add to the class, please let me know that. And there is a sign-in sheet. The purpose of that is at the end later on, I will go ahead and email you a kind of a summary of the things that we've talked about today. Okay. This is on a personal note. I was my mother's caregiver. She had uterine cancer. And when you hear the word cancer, life changes instantly, right? So I was working full time and trying to take care of her. And I did not know about a company like Beneficent. I could have gotten some more support. It's very hard, just like you guys are all going through these issues now, trying to balance life. The finances keep coming, the financial issues, your work, if you're working. Some people give up their careers. So if we can come alongside you and give you some support, that would be a gift, I'm sure, for you and your loved one. All right, so just a few questions for you to think about. Are you personally needing support? Or are you a caregiver for somebody else that needs the support? It could be an honor to be a caregiver, but it can also be very stressful and exhausting. And then we're just going to talk about how to get support, whether it's emotionally, financially, or maybe you need some respite support, a break. Often caregivers are overworked. And like I mentioned, some give up their careers. So we want to help support you. And then just figure out a way to pay for care would be helpful. Whether you want to stay at home or if your loved one needs to go into senior living community, we'll talk about both of those options. So let's talk about the problem that we see. So the financial misunderstandings that are out there. A lot of seniors, just like I don't remember, I didn't get your name, but he was saying how you're worried about, you're fine now, but eventually you'd run out of funds, right? A lot of people have that. They're worried about, I have too much. I make too much. I would never qualify for Medicaid. Because when I say the word Medicaid, what do you think of? Is it people with money or without? Yes. Okay. So we're going to talk about that. Okay. There's ways that you can keep the things that matter most to you and still get care paid for your loved one. Okay. Another problem is the cost of care. It's just too expensive. So costly. Or the amount of care the person is receiving, it's just not enough. Right? Oftentimes we have people come into our office and we ask them, how many hours of care does your loved one need? And they might say 2 to 3 hours because they're doing the math. But really, when we're telling them we're going to get care paid for, how many hours does your loved one really need? Now it changes usually like to 7 to 8 hours or something. Okay. It's important for your loved one to get the amount of hours of care that they need. The other thing is, caregivers, one person just can't do it all, right? If you guys are the caregiver, isn't it hard? Right, so it's time for you guys to get some support. And then if you wanted to apply, get some support, the whole process is just too complex, not for us, but for you, it is complex. So we can come alongside and make it so it's just easier and there's better communication. All right. So the outcome of a CMP. So a CMP is a certified Medicaid planner. By show of hands, how many people have heard of a certified Medicaid planner before? No? Yeah. Okay. So as just kind of an example, tax time, you go to a CPA, right? They know all the rules and regulations and guidelines with your taxes. So Stacy, as a certified Medicaid planner, means that she had to take a national exam. She is then, she knows the rules and regulations and the guidelines in order to help people to get qualified, even if they think they make too much or have too much, right? 100% success rate. It is important that people be able to get qualified without spending down everything that they've worked so hard for. And then the other thing is that a certified Medicaid planner would help you from the beginning, applying, all the way through to approval. So who do certified Medicaid planners help? They would help people that don't want to spend down, right? That want to qualify and be able to get care paid for. So what happens when you call a certified Medicaid planner? There's a 4-step process to that. So one is you schedule a strategy meeting. So we talk about what's happening with you and your family. You would learn the options. What are the options? We can give them to you and you can choose what's best for your family. Then we make a plan and then help apply. So where to start? Just knowing the facts and what is fiction. So let's talk about some of the myths that are out there. So the first one, and you guys can answer, it's a true false thing. Tell me what you think. Medicaid only pays for nursing homes. Is that true or false? That is false. It actually will also pay for assisted living, memory care, and home care too, if your loved one wants to stay at home. All applicants must sell their home. I hear some true, some false. So the answer to that is false. So your home is exempt with an intent to return home. You could even say, my loved one wants to pass away at home. There's different options in order to help keep your home. Estate recovery always takes the home. True or false? Okay, false. So planning can avoid it. So estate recovery is after someone passes away. There's something called probate, and they, if there's any thing that the state has paid out on, then they would want to come back and retrieve those funds back. Okay. That's not happening. Yeah, that's not happening. All right, can you give, this is a big one. Can you give assets away within the last 5 years and still qualify? Okay, that is one of my biggest myths. So it's actually false. There is a penalty might apply, and it's a time thing. The state might come back and say, well, for X amount of months, you need to privately pay. But after those months are over, then the state's just going to step in and say, thank you for paying for those amount of months. They're going to pay for care for your loved one for the rest of their life, as long as you stay within qualification. Okay. My spouse's income, or sorry, spouse's income disqualifies you. Does the spouse's income matter? False. So it's actually, it's the spouse's income, it's of no concern. It's not counted. Is Medicaid only for low income? I wish they had a different name for the program we're talking about today. Because it has the word Medicaid in it, it's very confusing for people. So just think about, there's the low income insurance-based Magi Medicaid. Think of it as a box down here. There's another program called the Long-Term Care Medicaid program. That is serving the middle class clients. That is serving all of you that have worked a little bit harder. You're going to run out of funds at some point. You don't want to deplete everything that you've worked so hard for. So that would be false, right? There are rules and set in place in order to help support middle class clients. 70% of people that try to do this process on their own are denied. And that's what DHS, the Department of Human Services, tells us. That's a lot. But if you have support from a certified Medicaid planners that know the rules and regulations and the exceptions to the rules, we can help, right? So let's talk about, what is long-term care? What does it pay for? Non-medical home care, if you want to stay home. Assisted living, memory care, full skill care, and adult daycare. All of those things. Do we have any veterans in the house? Thank you for serving. That's great. So I want you to think the VA aid and attendance, this is also a fantastic program. It would also cover all of these services. Okay. For our veterans, again, lots of rules and regulations to qualify for this program. We can come alongside you and help you with that as well. I also want you to think about the surviving spouses. But this program in particular, there is a cap to this. So, and it says here that a veteran can keep up to that $159,240 in assets. That is also excluding one car, one home. So if there's a surviving spouse, what this is saying to you is that surviving spouse can get assistance up to that $1,500, right? If it is a single veteran, they can get up to that $2,358. If you need more care than that, then we would just be talking about, or if you're not a veteran, we'd just be talking about the long-term care Medicaid. But we do like to give our options, right, to our veterans and let them pick. Let's talk about Medicare versus Medicaid. It's very confusing. So Medicare, 65 and over, right? Everybody, it's a given that you can sign up for that, and it covers hospital care, rehab, skilled for a short amount of time. If in a rehab center, that's it. If someone's in a rehab center for about 20, really short. Yeah. Right. Yeah. Right. So it does not pay for long-term care, personal care. And with this long-term care Medicaid or that VA aid and attendance, it would just cover all the things that we were talking about. Okay. So a lot of people need more care after they've been in a rehab or a hospital or something like that. Or even if you're at home, you need more hours. So that is based on, there's a financial assessment that's done and a care needs assessment. How many hours of care is needed? So there's lots of different state and federal programs, the VA aid and attendance that we talked about. Under the long-term care Medicaid program are all these, either skilled nursing, home and community-based services, that's helping somebody if they're at home and need care. There's something called PACE or InnovAge. That's what the couple here was talking about. Another good program as well. The thing I want you to know is that if you get qualified for long-term care Medicaid, that means you would now be qualified to go into PACE or InnovAge if you chose to do that. Okay. So a certified Medicaid planner can help you to just qualify sooner instead of looking at the financial portfolio and spending down and then qualifying for that program. We can help you financially way up here to get approval for that program sooner. There is a new program that we're all very excited about. It's a CFC, the Community First Choice Program. It allows for someone to stay at home and get more care hours. So this came in effect July 1st. There's over 10,000 people that have already signed up for this program. It is for, here it says that it covers up to 16 hours. We just found it would be a 16-hour shift. It's one employee cannot work more than 16 hours. If someone actually needed more care than that, then we could figure that out as well, based on that care needs assessment. But it's really designed for somebody that is more maybe in a skilled, they need a skilled level of care, but they want to stay home. That is a gift for families. So we're excited about that. All right. And then also sometimes a family member, maybe it's you, that wants to be paid to be a caregiver for your loved one. That's also an option for this.
Kim,
Yes.
sorry, that needs assessment, that's done, that's the TRE assessment that you're,
Yes.
Okay.
Yeah, we help you guys qualify on the financial side. We don't do that care needs assessment. By the way, that's not a time for you guys to be a hero. And my mom can do so much. It's really based on what can your mom do if nobody's around? If you were not around to take care of your mom, what would the situation look like 2 days from now, a week from now, a month from now? Is she bathing? Is she dressing? Right? Is she doing, it's called activities of daily living. That's how you would need to answer that question when you do the care assessment, by the way. All right, so let's talk about some of the eligibility requirements. So either someone needs to be over the age of 65, blind, or disabled. So there is an income cap of $29.01 a month. However, anything in yellow is like the exception to it, okay? So if the person's income is higher than that $29.01, then we would use, it's called an income trust. We would help them to be able to do that form. It's a simple form. We can help do that. So, and I'll show you a chart in just a moment so you can actually see how much someone can make a month. It's a lot higher than that $29.01. There's also accountable assets, things that are held over 30 days. So like a single person, it says a single person can only have access to $2,000 a day that they apply. A married person or married couple can only have $157,920. They can only have access to that the day that they apply. So with proper planning, they can have more than these figures. They just need help. And that's probably in the bucket that you guys were referring to earlier, that you have money now, you have resources now, but you're worried about depleting them. That's where that would come into play. Back to the functional needs assessment. So again, 2 activities of daily living is the care needs assessment. So let's look at the exceptions. Find where is your loved one at? Where are they living? Where are they residing? So right now we're in Region 3, right, in El Paso County. So what this is saying to you is that the income cap truly, it's not the $29.01, it's the $9,290. That's how much someone can make an income a month. So if your loved one is in Denver, look at that, it's $11,556. Is that a poor person to you? Right? It's what we didn't know about. So today's a new day, right? So now you know, and now you can get, yes. Yeah. Okay. Yeah.
and I'm making $5,000 a month.
Mhm.
Theoretically, that 2,000, whatever, I can't do math, over the 29.01 goes into the income trust.
Yes.
But if I make over that 9,200, I don't even get to play with Medicaid at all.
No,
Under that 9,000, then I get to.
Right, but let me say, we're talking about just the income piece, not what's in your savings. It's monthly income from Social Security and pensions, not income from IRAs, just Social Security and pensions.
Yeah.
In the last 10 years, I've only met 2 people that are over that, and they had a full military career, and then they did another career for the state of Colorado, and they have para, and they were over these limits. Listen, nobody is over income, but you're told you're make too much all the time.
Right.
They just don't know how to get benefits if that's you. So a person with $9,290 a month is not poor, but they do qualify here. Okay, it's income we're talking about, not resources or assets, that's checking, savings, all that. That's over here. That's a different thing. Okay, just to be clear.
Very good. All right, so let's talk about a married case study. Okay, so this is Mr. Johnson. He is in a rehab center here in Colorado Springs, and he's going to discharge next week. So together they have a home, they have a car, they have a 401k plan that with $80,000 in it and $200,000 in cash. Can Mr. Johnson qualify for long-term care Medicaid?
Yes. Yeah.
Yes, we are always looking for a yes. We just need to help strategize. So the solution to this is that Mr. Johnson's assets can then be given to his spouse without penalty. That is one of the strategies that could be used. All right.
So is there a definition of spouse that the state uses?
Yes. So if you filed a tax return jointly or you share a bank account, so spouse isn't just limited to people who were or have been married and have a marriage license. It also extends to same-sex couples. It extends to people who haven't been married, their common law. It's anyone you filed a tax return with or have a bank account with that would hold themselves out to be a couple. Okay.
Thank you.
So it's fantastic as a couple. Yes, remember that 5-year look back? Yes. Yes, but the question
No,
is,
it doesn't apply here to spouses.
Right.
Look backs don't apply to spouses or giving assets to disabled children. Children with a disability designation. And that could be a 55-year-old daughter who has MS. So you got to know the exceptions to the rule. I mean, they're super important.
Yeah.
Wouldn't you say? A spouse. A
Mhm.
spouse is going to need the money.
Yes.
Mrs. Johnson will need this money to live out her life at home in a community. She doesn't need care. He does.
yeah, the state does not want the spouse to go poor and destitute trying to take care of their loved one. So, yes.
Most of our assets are in a family trust.
Okay.
Would that make things different? As far
No.
as-
Well, you still count it the same way. It depends on how much is there. And we would have to, we carry a license to preserve the things in a family trust. I mean, I met with a client yesterday that's got over $1 million in these family trusts. Some of it's in assets and some of it's in property. And we just have to know how to weave that through the rules that are there and fully disclose it so we can get care. The goal is not to spend all that but you would think that because they tell you can only have so much money. And that's not what the code says. The code says you can only have access to so much money on one day, the day you apply. All the other days you can have access, but not that day.
Fascinating.
Isn't that interesting?
Right?
All right, so let's talk about how many single people do we have in the room?
Well, single person.
If single
needing
person
care.
needs care, yes, yes.
Yeah.
Okay. Yeah, that's a good clarification.
Yeah.
So a single person that doesn't have a spouse, the problem is that if the person is single, they don't have a spouse to give to, like Stacy was saying, then we have to strategize just a little bit differently for a single person, okay? It's not that they can't qualify, we just need to strategize differently. Yes, so if someone is widowed, they're now considered single. If they're not married, and like she was just saying, the definition of marriage, right? If they don't fit in one of those categories, then they're considered single. Yes.
Other than a spouse.
But that penalty is a time frame, so I don't want you to panic when you hear that word, the penalty. Okay. So the solution to this is 60 for a single person, 60% or more of the assets are preserved, and 40% or less is then used to privately pay for home care if the person wants to stay home. Okay, but that single person can then do things like gift funds to a loved one, maybe to the beneficiary or maybe to a child or whatever. We would help you strategize and figure that out so that that person can also not have to spend down everything and then qualify. They can qualify sooner.
And sometimes they don't even have to gift it to protect it. I know this sounds so foreign
Yeah.
to you guys, but sometimes they don't even have to do a gifting. They can actually keep the asset. You just have to get it ignored under one of these exceptions. And there are ways to get assets ignored. You report them and they go, oh yeah, but we don't have to count that.
Yes. I know we hear that a lot. Yes. Yes. All right. So that's some of the,
Don't cry.
okay. Yes. Here's some of the key takeaways. Is that, that one of the challenges that Medicare, it doesn't cover non-medical personal care, right? That the families need and know, but you have to understand the rules. And then the solution is that, remember that new CFC, the Community First Choice Program, that covers more hours of non-medical home care if your loved one wants to stay home. And then also, if someone needs assisted living, full scope of memory care, there are solutions for that. We can help protect assets. Yes. 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 Yep. Yeah, non-medical home cares, they come in and they do things that like bathing, dressing, toileting. They do things just to help you with your day-to-day activities. Because going back to, remember I was saying, if your mother was left alone, nobody was checking in on her, how would she be, right? So that's the care assessment that's done. So if they do that care assessment and they find, oh, she needs help with bathing, she is not dressing. She will wear the same pajamas for a whole week, right? That's not okay for, they need to bathe. Everybody needs to bathe, right? So they would get assistance with that. So yes. They're saying during COVID, they can wear their pajamas all they wanted. That is a fact. Okay. Yes. Yes.
Here down.
All right. So I want to open it up to answer questions. While I do that, though, remember I promised you that there'll be a time that you can give feedback. You can scan this, and if you'd like to give us feedback, your opinion matters to us to help us improve this class. But I want to open up the floor. Stacy is here as well. We can answer any questions that you have. Yes.
It's one of the carve outs they made for spouses and disabled children because we want the assets to stay in a family. And so they decided that 5-year rule, if you gave money to a child that's not disabled, they're going to assess what's called a penalty. It sounds terrible, but it's not. Almost every case will accept a penalty. Great. Give me that penalty so I can spend what I need to spend. They're not paying today. We're trying to get to a point where the state will help. And so we'll accept the penalty, but they just carved out spouses get preferential treatment.
Your microphone, Margaret.
No one else but spouses and disabled children. There is a carve out on a house for a brother or sister of the person who needs care that's been in the home with them. You can give away a house. I mean, we could be here until midnight talking about the exceptions. We just mentioned a few. Don't think there aren't some that apply to you. They're there.
Yes.
Would a daughter who had cancer but is fully cured be considered a?
She has to have a Social Security disability designation. Okay, we have to have a disability designation given.
But it doesn't mean that you can't give to that daughter. You still can. We just need to help strategize, right?
Yeah, just,
Yes.
I mean, again, it's so hard because every family has a different set of circumstances. People ask me, is this on your website somewhere where I can read and go do it? I'm like, no, I would not ever do that because you would take something as one thing and it's another. But make an appointment, come to our office. We'll give you your strategy that you can go do on your own.
Yes.
None. My mother told me no one will come see you, Stacy, because they already think they know all the rules. She said, you got to offer it for free or they will not make an appointment. And I think that's true because we're trying to hang on to every dollar, aren't we? And make it go as far as possible. If I charge $300 an hour or something, you would go, I'll read it on chat GBT.
And then I'll get it wrong and I'll get denied and then I'll call Stacy.
And then you'll call me.
Yeah, and time is money, right? So it is a personalized care plan, right? Like she said, everybody's financial situation is so unique. And then having legitimate, clear options is very, very important for families. And then knowing that the goal is to have approval. We're always looking for a yes, right? We're always looking for ways to make that happen. All right. I brought brochures for you, but still ask your questions. I'm going to hand these out to you, but ask, it's not every day that Stacy comes to one of these meetings. She really wants to be here.
How did you get done?
So I guess I am confused about, is there a cost involved in this service?
So let me answer that.
Yeah.
So when people come in, we will tell you what to bring. And we're going to package up for you everything you would need to get it done. Let me be candid. If you don't have any money, we're going to tell you and we're going to give you everything. And we're going to review your application before you submit it because we don't want to see you get a denial and have to start over. Y'all know it's a 90-day process. For people who have funds, you might want us to do it for you. It takes my case managers on average 120 hours to get a case through where we're preserving an estate. But you all were going to spend down anyway. And we're trying to have that not happen. You might want to pay us to do it. It's optional. I will give you such a great outline and all the forms and give you a flow chart on how to do it yourself. And you can do it. I hope you're successful, but let me tell you, they give us a bad time because they're only used to seeing people without assets. And so for that, we charge a fee. It's flat, meaning we'll say, this is $10,000. Let me go on the high side. This is $10,000. And you can decide, do you want to pay us to do it? Maybe we're not worth it. Or do you want us to do it? Either way, I'm giving you everything you need to do it.
Right.
Okay. There is no barrier for you to getting information so you can be successful. Some people, though, are like, I don't want to do it. You just do it. They will pay us to do it. Also, those people that pay us to do it, they give to our foundation. Our foundation is how we are able to do people at no charge that have no money. Maybe they just have a family ranch they don't want to give up. And we're going to navigate them through that. They cannot get this done on their own. There's no way. And so we'll do it for them. I still pay people to do it. And so people that have paid us what I think is a lot of money will also give to our foundation on top of that.
Very good.
I'll just review what Kim said earlier in the slides. People that do it on their own, 70% of you will get denied. And then you have to deal with a lengthier period and all of the things, right? So sit down, find out what it's gonna take, find out what they're gonna charge and make the decision if that's the best one for your family or not. But she's gonna give you the outline. So it behooves you to get this information.
Mhm.
Maybe you don't need it today, but like David said, the day's gonna come when your funds will be depleted. So know what this looks like so that you know when it's time to pull the trigger and get the care get the care paid for that you need.
And the sooner you do it, the more you get to preserve. Listen, I've had people preserve $100,000. And I said, what are y'all going to use the money for? They said, we're going to buy a wheelchair accessible van because what's important to my mother is to go to church on Sunday and out to lunch. She was in a wheelchair. They couldn't possibly get her out of a wheelchair into a car. They bought a van that picked her up, put her in, took her out, only for that purpose. It was a much better use of funds
Yeah.
than spending down.
Yes.
I've had people bring in all their relatives for Christmas because they didn't know how much longer their loved one was going to live. And not everybody could afford to come in for Christmas. And they used the money for that. So we're trying to get to a higher quality of life for people who are marginalized because of their health, right? So there's great reasons to do it, I think. And the sooner you do it, the more you can preserve for things like that. I've had people that are in care, they just want to help support their grandkids through college. I mean, I can give you a lot of reasons why they don't want to spend the money down, but they don't want to compromise care.
Yes.
And care is number one. So we have spouses that are being paid to be the caregiver. Don't let that hit you wrong. They quit jobs or whatever. The state's going to pay somebody. They should pay the spouse. So, and the other thing I would tell you is, because I have a call, I have to get on in 5 minutes with a financial advisor and a client, but this guide program, we're working with Lisa Sharp and Medicare that you all have already follows this program. Please, please, please investigate this program. It's so important. And I've vetted it. It's good for you. It gives benefits to that person. And then behind that, we would come in and get the rest of it covered, but get what you can. This is going to be available. They're going to assess it in 2 years from now, how helpful it was. And no one has the information. It's hard to understand what this is, but the guide program is so valuable, so valuable. So,
Okay,
okay.
we've already gone through the spend down and everything. She's on Medicare, Medicaid in Denver. I feel like
You need
in
to call our office.
we don't know where to go
Yes.
to get her down here.
Call
at the end of the-
our office. We'll give you an outline of how to get that transition done. Okay, we'll save you some bumps in the road. And there isn't a fee for it. Just call and get the info. Yeah.
We reached out.
Yeah.
Throw everything possible at them. Get Stacy's outline, do it all.
Gotta get her off of Innovate on the tree.
Yeah, well,
And tree hasn't been very helpful.
and they won't.
Just call us.
Absolutely.
Listen, we're gonna give you a straighter path and you're gonna meander through from all these organizations. They mean well, but they never see someone from start to finish.
And they don't talk to each other.
And
Nope.
so we'll give you a straight path.
Okay.
You just need to
Yeah.
call.
And when you call us, you get a human. It's wonderful. So a friendly voice is on the other line and we help you. Yes, sir.
Do you make visits to people's homes?
Very good question. The answer to that,
No. Anytime I've done that, I'm competing with a cat, a dog, and who knows what else. I'll do it by phone, by Zoom, or a lot of times I'm only meeting with the person giving care. and they come into our office. Okay, so I've not ever had a great experience going to someone's home. But
We
if
also,
do a Zoom with you, you'll get a recording and you can play it for whoever needs to help. You know, we're just,
I have a question. It was brought to my attention by a friend the other day that her mother's now in a nursing home, but she was enrolled in PACE. PACE didn't want to turn loose and created like a 30-day gap to get her from PACE, which is more or less, she's living at home, right? And she's going to these programs, but she needed nursing home care at some point. And when she tried to get, because PACE is paid through Medicaid, and when she tried to get her mother transferred, there was a 30-day gap.
there is. That's because when you go into skilled care, there's 30 days. The rule says you have to have privately paid for 30 days. However, that's the rule. I think there's an exception to the rule. Guess what? There's an exception to that. PACE would work with the community. They can figure out the money. Let them figure it out. Don't just, and get
Well,
transition.
I gather she got stuck, so she ended up paying
Yeah,
that 30 days.
I don't know how she could pay. She's on Medicaid. She didn't have access
No,
to
her
any
daughter,
money.
her daughter, my friend.
They should call us on stuff like that. I
Okay.
mean, just call us. We'll get those two people together and get them transitioned. We will help you all do that. There's not fees for that. You've got to ask for the help.
did everybody get that sign-in sheet? Because I will give you a summary of what we talked about. Yes, go ahead. Sign-in sheet, yeah, let me get this.
So I'm gonna hop out of here because I'm on time for a meeting. I'm gonna go do it in my car with my phone. I got a new phone yesterday, first time in 4 years, and not everything's on it, so I'm juggling. But if you'll just call our office, we'll talk to you by phone. We'll get you connected with a case manager and try to straighten your path a little bit.
Thank you.
Okay,
Yeah, thank you.
but Kim probably can answer some questions.
Yeah. Awesome.
Okay, are there more questions? Because I don't want to cut off questions. This is a great opportunity to ask all your questions, so feel free. And then if not, we'll take a quick little break.